socially acceptable and easily accessible. So there's a need to investigate these plants first for their safety and their effectiveness as alternatives for the management of rheumatoid arthritis. My broad objective was to investigate the pharmacological and phytochemical profiles of extracts and bioactive compounds from Kenyan Ruellia species. The species in this study were Ruellia prostrata, Ruellia bignoniflora, and Ruellia lineare bracteolata. I had 4 specific objectives. The first one was determine chemical, chromatographic, and spectroscopic profiles. The second one was to determine antioxidant, analgesic, and anti-inflammatory activities. The third one was to determine in vivo toxicity of these extracts, and finally to evaluate both in vitro and in vivo and arthritic activities. These species were collected from Isiolo. Isiolo was Ruellia lineare bracteolata. Kibwezi was Ruellia bignoniflora. Machakos and Mwala was Ruellia prostrata. The chemicals and solvents for chemical profiling were, these are a few of, most of them, they were from Sigma Aldrich and Mark, Germany. I had the 2 equipment for getting the extracts. The rotary evaporator is the one that gave me the organic extracts, whereas the freeze dryer gave the aqueous extracts. I don't know why the slides are moving ahead before I speak. Sorry about that. So,
Dr. Wangia, maybe you could still make your presentations without necessarily the slideshow, if that is what is bringing the challenge, without doing a slideshow. You can just...
okay. Okay, for spectroscopic profiling, I had 2 equipment. One was a Shimazu FTR spectrophotometer, which was of the range that 500 to 500 per centimeter, and the GCMS was a Shimazu GCMS coupled to an auto sampler, and the grades, the HPLC grades, were used for the GCMS. The chemicals for in vitro and in vivo were from Sigma Aldrich. The reference drugs for in vitro and in vivo analysis were acetaminophen, ibuprofen, diclofenac, sodium methotrexate, which were obtained from Sigma Aldrich, and morphine sulfate was obtained from Martindale Pharma, UK. Laboratory animals were sourced from Safari Animal House, JQuat, and 2 species were used. Worcester albino rats and Swiss albino mice were used for these experiments. The plants were collected from their natural habitats by the help of a plant taxonomist, and water specimens were deposited at the Department of Botany Herbarium, University of Nairobi. The schematic presentation, the sample extraction and analysis. After getting the plants from their natural habitats, they were dried under shade for 2 to 3 months. After that, after the stems snapped, that was the time it was, the samples were dry. They were extracted using both aqueous and organic extracts. Methanol extract was an organic solvent for in vivo analysis and other in vitro analysis, but for spectroscopic profiles, the extracts were obtained by methanol DCM in the ratio of 1:1. When the extracts were obtained, chemical analysis was done, where both qualitative and quantitative analysis were done. Some chemical crude extracts were subjected to chromatographic analysis, spectroscopic analysis, and bioassay. From chromatographic analysis, fractions were obtained, which were subjected to spectroscopic analysis and bioassay. Chemical profiling, the phytochemical screening was done by observation of color change or precipitation, and quantitative profiling was done for flavonoids, phenolics, and saponins. Chromatographic profiling. TLC profiling was done using silica gel on commercial TLC plates, where the fluorescent indicators were able to give spots at wavelengths 254 nanometers or 365 nanometers. There are various solvent systems were used. The best solvent system was methanol DCM 9.5.5, methanol DCM 1.1. These were the best. I tried very many of them, but these are the ones that gave spots. For the spots which were not detected on TLC, either under visible or UV, the compounds were derivatized using vanillin, concentrated sulfuric acid, and iodine vapor, and I was able to spot them. We get RF values when the spots were obtained. RF values are distinct for particular compounds. That is the distance traveled by the compound over the distance traveled by the solvent front. FTR profiling determined functional groups. There are two regions. We have the functional group, which starts from 3,500, 1450 per centimeter, and we have the fingerprint region, which comes from 1,500 to 800 per centimeter, which is mainly more complex vibration, and this one distinguishes the compounds. GCMS determined the compounds compared to NIST library, where retention time, molecular weight, molecular formula, compound name were used to get the kind of compounds that there were. Pharmacological assays. Before working on animals, it is important to have methods that use in vitro methods. So there are two in vitro methods that I used before I began working on animals, using the animals. One was in vitro antioxidant activity, the other one was in vitro and arthritic activity. So in vitro antioxidant activity was based on DPPH scavenging activity, where the DPPH radicals were reduced and they turned from dark blue to yellow. The concentrations that were used were 3.95 to 500 micrograms per ml, both for extracts and ascorbic acid was used as a standard. After the reduction, the absorbance was read at 517 nanometers using an ELISA reader. This is the basis of DPPH. It has a stable radical or centered nitrogen radical, which antioxidants normally scavenge by donating an hydrogen to make a covalent bond that is stable. And when it is oxidized, it is purple. When it is reduced, it becomes yellow, and the absorbance is read at 517 nanometers. And the percentage inhibition was by that formula, absorbance of DPPH sample and over the absorbance of DPPH.
Dr. Wangia,
yes.
Excuse me, maybe in the interest of time, because we only have about 30 minutes for your presentation and 30 minutes to get feedback. Yes. If you could maybe move to your findings, maybe that would be because of time. Yes.
Okay, then I can move to the results.
Yes, please. Thank you.
Okay, I'll move to the results. Okay, quickly, the in vitro and in vitro test was the antioxidant and in vitro and arthritic test. The in vivo determined analgesic activity, where the tail flick method for acute pain was the one that was used, and progressive pain was a formalin test. Then the inflammatory activity was determined by carrageenan, which is an irritant that is injected into the right hind paw to determine the swelling. The anti-inflammatory activity was determined using a digital plethysmometer, whereas pain was determined using a digital analgesiometer. So we shall go to the results. When the extracts were done, this was sequential extraction. One sample was extracted using petroleum ether, ethyl acetate, chloroform, and methanol, and then we had the aqueous extract. It was found that the water extract gave the highest yield, with the bignoniflora giving the highest yield, followed by methanol. So the in vitro and in vivo, for in vitro and in vivo experiments, the water and methanol extracts were the ones that were used. So these others were very small. For qualitative analysis, phytochemical analysis, we found that all the 3 extra species had saponins, phenolics, glycosides, flavonoids, and terpenoids, and they all lacked alkaloids. Both aqueous and methanolic extracts, they had a similar trend. TLC chromatogram of these compounds, this is the Ruellia prostrata. It showed 7 compounds under visible light. Ruellia linear bracteolata and bignoniflora did not show as many spots as the one for prostrata. Under vanillin spray, I said that I was able to detect other compounds which were not visible under visible light or UV at 254 and 365. So vanillin spray derivatized some compounds which were able to be detected. This is iodine spray. This is also another way of derivatizing the compounds to be able to see the spots. So I got RF values for all this. It was found that Ruellia prostrata had 7 spots under visible light. Linear bracteolata bignoniflora did not show any spots under visible light. But under 365 nanometers, Ruellia linear bracteolata and bignoniflora showed 3 spots, which were also part of the ones that were in prostrata. So prostrata had more spots than the 2. So I will refer to prostrata as RPM, linear bracteolata as RLB, and bignoniflora as RBK, because the names are long. So this is the summary. Prostrata showed 7 spots, 8 spots under UV, 6 spots under vanillin, whereas RBK and RLB showed similar spots at 365 and vanillin, and there were no spots visible light. This is the spectra of the FTIR. This is 365 to 3200 is OH. We find that all these species showed similar strength in FTIR. Even the crude saponin that was obtained from quantitative analysis was also subjected to FTIR, and you can see the spots, the spectra were similar to the parent compounds. GCMS showed various compounds. This is the aqueous extract. We got this was a disaccharide, alpha glucopyranose galactopyranosyl was a saccharide, which I would say that it might have come from maybe saponin or flavonoid, because of the temperatures that were used in GCMS around 250 might have broken off from the parent. Then we have octadecenoic acid, methyl ester, docosenamide. All these compounds that are here have been reported to have anti-inflammatory activity, even ascorbic acid 2,6-dihexadecanoate. So this is the antioxidant activity. It showed the dose-independent increase in inhibition of DPPH radicals, dose-dependent, with the highest activity at 500 micrograms per ml. The same one I used for getting the IC50, and IC50 of Ruellia of RPM was 51, RLB was 7.2, ascorbic acid was 2.1. So this one was the nearest to 2.1. But when we come to the methanolic extract, RLB's, the IC50 was 2.9, which was very close to ascorbic acid. And the methanolic extract found that all the 3 species had highest activity, similar highest activity at 500 micrograms per ml. So this is the results for the in vitro and anti-arthritic activity, it was based on inhibition of protein denaturation by heat. So this was this is a method that is used to determine in vitro and arthritic activity. The organic extract and methotrexate. Methotrexate was used as a standard because it's a disease-modifying anti-rheumatic drug, whereas diclofenac sodium was used as an non-steroidal and inflammatory drug. So you find that the organic extract of Ruellia prostrata had similar and arthritic activity in vitro like methotrexate, and their activities were higher than even diclofenac sodium. In vivo toxicity, this is a method that we try to test the activity of a new compound on acute toxicity and subchronic toxicity. For acute toxicity, 300 milligrams, 2000 milligrams were used in animals and in rats, nulliparous rats, and these were the observations. FAR was normal, posture was normal, breathing both at 300 and 2000 milligrams per kilogram, even after 14 days. So for chronic toxicity, a drug was given, the extracts were given for 28 days and observed the same like in acute toxicity studies. But then at the end of the experiment, after carbon dioxide euthanasia, blood was drawn quickly by cardiac puncture, and it was tested both for biochemistry and hematology. So we find that these parameters, the total protein, liver enzyme tests are these four. The last four, the liver enzymes, total protein, there was no difference between the untreated control and Ruellia prostrata. Electrolytes, these are the results. There are some changes in the sodium chloride and creatinine, urea, and potassium. There was no difference. Random blood sugar, there was no difference between untreated control and prostrata. Fasting blood cholesterol, there was no difference. There was no statistical difference. When we come to blood count, whole blood count, there was a difference in red blood cells where the prostrata had slightly more red blood cells and MCV was slightly less. But all other parameters there was no difference between prostrata and untreated control. Hematological parameters were also determined where there was a comparison between the extract and normal control where there was no difference. But when I compared the extract and the methotrexate, which is a known anti-rheumatic drug, I found that the neutrophils, lymphocytes, monocytes were even a third of the extract. And the methotrexate is known to suppress the bone marrow, which was clearly seen in this experiment that the extract never suppressed the bone marrow, whereas methotrexate, although it had an arthritic activity, but it suppressed the bone marrow. The internal organs were also determined to see the effect of the extract on the heart, liver, kidney, lungs, pulse, uterus, and these are the results for the pain. The pain was done where the mice were exposed to heat at 55 degrees centigrade, and the time they flicked the tail, that was the time that was recorded. So there was a dose-dependent reduction in reaction time, increase in reaction time, with the Ruellia prostrata showing highest activity at the first hour. This was determined for 6 hours, for 6 hours. So we find that at 3 hours, that was the maximum time that there was an increase in the reaction time, with Ruellia prostrata showing highest activity. Morphine was used as an opioid analgesic, where the activity was highest the first 2 hours and it reduced afterwards. Acetaminophen had even less activity, but still activity was highest first hour and second hour. I did both methanolic and aqueous extract for both of them. Then I determined the potency where we get the ED50. So we find the ED50 for Ruellia prostrata was 358 milligrams per kilogram, which is more potent than RBK, which was 820. That is the aqueous extract. The methanolic extract had as a bigger value for ED50. So in this particular experiments, the aqueous extract were more potent than the methanolic extract. This is formalin-induced. Formalin-induced is used to determine progressive pain, which we can also say clinical pain. After injecting formalin, the animals were licking, biting, or flinging their bodies, biting and licking the injected core and flinging their bodies. This was determined in blocks of 5 minutes for 1 hour, and it was found that after 15 minutes, there was highest activity, which reduced, and then again, higher activity from 45 minutes, which was biphasic in nature. It was determined that the first phase may be due to the release of vasoactive elements like histamine, 5-hydroxytryptamine, whereas the later phase may be due to inflammatory response to COX pathway, where leukotrienes and prostaglandins are involved. So both methanolic extract and aqueous extracts were determined. So what is going to give us a summary is also the ED50. The ED50 of Prostrata, or the first 15 minutes was 22, whereas the second 45 minutes was 7.7. So it was more potent in the inflammatory response compared to the first response. There was activity both in the first phase and second phase, but it was more potent in the second phase. The methanolic extract showed a similar trend, but the less than the aqueous extracts. The activity was less than the aqueous extract. This is the swelling where carrageenan was injected into the paw of the rat, and swelling was determined by a digital plethysmometer. The activity was taken for 6 hours, and still Ruellia prostrata showed the highest activity with the maximum activity at 6 hours. ED50 was also determined, and Prostrata had 168 milligrams per kilogram, which was more potent than the other two. Same to methanolic extract. The activity was highest at 6 hours, but the activity was lower than in the aqueous extracts. In vitro and arthritic activity was based on inhibition of protein denaturation by heat, and the protein was bovine serum albumin. So the method was standardized. We wanted to find out if this protocol is reproducible. And after many attempts, it was found that it was reproducible with 5% margin of error. So this method was adopted to be a quick method of detecting in vitro and arthritic activity before going to the in vivo. So this is, again, I did both the aqueous extract and the methanolic extract, and the margin of error even in the methanolic extract was less than 5. Both of them were less than 5%. So because this method was reproducible and reliable, I decided to use it as a quick method of finding out the activity of these extracts and reference standards. Reference drugs. Diclofenac again was used as an non-steroidal anti-inflammatory drug, and methotrexate was used as a disease-modifying and rheumatic drugs. And we can see from IC50, from this activity, that methotrexate was as active as the organic extract of Ruellia prostrata. I also did the IC50. IC50 of methotrexate was 0.17 micromilligrams per ml, whereas that one of prostrata was 0.29. So it was very close to the one of the standard. In vitro, in vivo, and arthritic activity. In vivo and arthritic activity was determined by injecting complete fruits adjuvant at the base of the tail of the rats, where there was an immunological response, and from 12 days, the 12th day, the animals developed swelling, symptoms of arthritis. This is the untreated control. This is the untreated control, where it was injected with complete fruits adjuvant with no treatment. This is the extract, and this is methotrexate. We can see the one which is not treated, there's ankylosis, there's redness, erythema, and this is how actually the pulse looked like. So many things were done. I determined the swelling of the left hind paw, the swelling of the right hind paw. The left hind paw, we can see that from around 12th day is when the swelling started, with the maximum on day 16. This is the extract and the methotrexate. They had a very similar trend, and on the day 28, even the extract had smaller percentage edema. This is the untreated control. The swelling continued up to day 28. This is the right hind paw, similar trend. Day 16 maximum, then it went down, but the control, the negative, the untreated arthritis control, they continued swelling. I also did the thickness. The swelling was done by the digital plethysmometer. The thickness was determined by vernier calipers. Similar trend, day 16. The experiments were showed a similar trend in both swelling and thickness. So this is the left hind paw. This is the right hind paw. This is grip strength. Grip strength was determined by putting the animals on a rotating rod. The rod was raised to 30 centimeters above the ground where the animals get scared to fall off. And the revolutions were 10 revolutions per minute. So the animals were acclimatized for 5 days, for 1 week. After that, they were given the extract, they were given the standard, and the gripping is the time they were taking to fall from the rod. So you can see that this is the untreated control. From the beginning to the end, actually they developed endurance and they stuck on the road more than at the beginning. This is the extract, this is methotrexate, this is the untreated. Untreated they were not able to grip the road. And this is a way of determining the crippling in the humans. The experimental model is the rotating. The arthritis score, the pause was scored. Each score was given a point of 4, where maximum was
from another university, and I think from another department.
Where the maximum score was 16. So this is the extract. It depended on whether it was 1 paw swollen, 2 paws, 2 digits, so erythema and chylosis, all that. So each paw was scored out of 4, so the maximum was 16. The extract had the highest activity on day 16, where it was 7.83, whereas the untreated control continued to increase up to 11.67. Methotrexate was similar to the extract. This is the weight. All the animals increased in weight from the beginning to the end. There were other non-articular symptoms like nodules on the ears and tails, vasculitis, and where I compared the arthritis-induced control and the extract. Even in the arthritis-induced control, the whole tail actually became thick and very hard. So the swellings were in the digits, others middle digit only, but the goodness is that in this experiment, there's no animal that died for the 28 days. So actually it showed the safety and of the aqueous extract of Ruellia prostrata. So in my discussion, before doing any animal experiments, it is important to do the in vitro, or we call them the 3 R's. Replacement, reduction, and refining. Can we have a protocol that can replace the animals and still give us results? And for that, I did the antioxidant and in vitro and arthritic activity. When I got good results, that is when I went ahead to do the animal experiments. So the anti-arthritic activity of Ruellia prostrata and methotrexate was similar, as we have seen, and it was even more potent than diclofenac sodium, which is an non-steroidal anti-inflammatory drug. So it is in this finding, it is the in vitro and arthritic protocol is a protocol that I tested very many times. It was reproducible and reliable. So it can be adopted to investigate new anti-arthritic drugs before they are subjected to animals. It was reliable with a margin error of less than 5%. And then the in vivo anti-arthritic studies actually confirmed the in vitro anti-arthritic activity. And studies of activity of Ruellia prostrata. So in these studies, Ruellia prostrata improved the clinical manifestations of arthritis parameters such as hind paw swelling, hind paw joint thickness, grip strength, arthritis score, and non-articular symptoms. There were no adverse effects on internal organs. When I did gross necropsy, I was checking for things like swelling, paleness, congestion of blood vessels in the liver, kidney, heart, intestines, lungs, and sex organs. Aqueous extracts of Ruellia prostrata, as I've already shown, it lacked bone marrow suppression, which was evidenced by methotrexate, which is a first-line drug in management of rheumatoid arthritis, but it has that limitation of bone marrow suppression. So aqueous extract of Ruellia prostrata could be considered a better alternative for the management of rheumatoid arthritis. So in my conclusion, The phytochemical screening revealed flavonoids, phenolics, tannins, glycosides, and terpenoids. These are compounds that were reported in other Ruellia species, and they have been implicated in management of inflammatory and non-communicable diseases. The 3 Ruellia species in this study exhibited antioxidant, analgesic, antinociceptive, and anti-inflammatory activities. Ruellia prostrata showed the highest analgesic, antinociceptive, and anti-inflammatory activities. And antioxidant, analgesic, and antinociceptive, and anti-inflammatory activities of Ruellia bignoniflora and Ruellia linearis were reported for the first time. There were not there, to the best of my knowledge, there are no reports on Ruellia bignoniflora and Ruellia linearis. So they were reported for the first time. Even the results have been published. Ruellia prostrata was safe on internal organs. Was safe both in vivo toxicity studies. It also was safe in vivo and arthritic activities, because I did both the biochemistry, histology, internal organs for both in vivo toxicity and arthritis. So the arthritic activity of Ruellia prostrata, as I've said, it lacked the bone marrow suppression. And also in vitro and in vivo and arthritic activity of aqueous extracts of Ruellia prostrata is being reported for the first time. So it's my recommendations for further work is to do several in vitro studies to determine the mechanism of action of Ruellia prostrata extracts, and such in vitro tests will include where are they, which inflammatory mediators are they working on? Is it the cytokines, tumor necrosis factor alpha, interleukin-1 beta, interleukin-1 6, interleukin-10. So COX pathway mediators like prostaglandins and leukotrienes, and immune system mediators like interferon gamma. So if this can be done in vitro, all this should be done in vitro first, so that we can be able to determine the mechanism of action. Further, we can also test these other parameters which are normally tested in rheumatoid arthritis patients, like C-reactive proteins, rheumatoid factor, anti-CCP, and ECR. These are some of the factors that are normally done in the lab for patients who are suspected to have rheumatoid arthritis. So if this can also be done in rats, it can also give us an idea of how this Ruellia prostrata is affecting these other processes. Then once mechanism of action is established, permission to carry out preclinical trials in a non-human primate may be sought from KEMRI, JPOT, where we need ethical clearance. So the ongoing work, I've not stopped. Whatever I've shared is what I did for my PhD work, but I'm still doing research on this species till today. I've not stopped. I'm doing structural elucidation of compounds by using NMR analysis. For now, there's the compound stigmasterol that structure is almost getting ready, and other compounds. But I know I'm doing NMR analysis from the University of Nairobi to be able to get the actual structures of the compounds in Ruellia prostrata. Another thing that is going on is that these species are wild. To get them in, and they are perennial. So to get them from the wild, I had to time when it rains, when it would rain. And for that reason, I did the soil analysis of the natural habitats of these species and compared to the soil in Kakamega County. And then there's domestication that of Ruellia prostrata is in the Kakamega County on a plot of around 2 acres, and they is doing very well. So if we can be able to domesticate this, that we don't have to be going to the wild all the time. And in addition to this, even domesticated Ruellia prostrata and arthritic activity has been detected using the in vitro methods. So it is not just domesticating, it's also getting the compounds to see if they're the same as the ones in the wild. But what has made me very happy is that the domesticated Ruellia prostrata in Kakamega County has shown in vitro and arthritic activity. So something that is very encouraging. Then registration of the herbal formulation. I have a trade name for this drug. It's called Jongotib. That's been registered by KIPI. That's the trade name, and I'm looking for registration by Pharmacy and Poisons Board for this herbal formulation for the management of rheumatoid arthritis patients. So in this kind of ongoing work, definitely I'm looking for investors investors to bring some cash to do all this work. This work is a lot and it needs a lot of money. And I think the end of this research can get an alternative medicine from Ruellia prostata to treat the rheumatoid arthritis patients. So really looking for investors to do this noble research. But for my funding, three institutions have given me money for this work. One is JPOT, one is JICA, and the last one is Chebu Pharmaceutical Limited. They are the ones that have given me money up to today, up to where I've gotten, but now I'm no longer using money from them. That is why I'm looking for investors to continue to get something from this research. Then I also have research collaborators. It was not just for money. There are institutions that have made me achieve what I have achieved today. One is Kenya Medical Research Institute. One is the University of Washington. One is the University of Nairobi. One is Southern Illinois University, Edwardsville, USA. And one is Institute of Primate Research. These are research collaborators that have actually given me an opportunity even to go to Southern Illinois University to see how the NMR machine works. They have been very cooperative and we are still working together. So with that, I thank you very much for those who have listened to my presentation. Thank you.
Thank you very much, Dr. Wangia, for that great presentation. Really, you did a lot of good work, and the university is really proud to be associated with this work.
Thank you.
And now I want to hand over to Rebecca, who is going to a Q&A session. So Dr. Rebecca Maina, please.
Thank you very much, Dr. Wangia, for that elaborate presentation. I wish we had more time to see how you actually did that work. Now, there are a few questions that have come up, and someone wants to know, what is the local name for the Ruellia, so that we have perspective of how the plant looks like for those who have not interacted with the plant before.
I think I might be answering one question at a time that I don't forget.
Yes, yes.
Okay, what I can say, my study on Ruellia was when I was pursuing my master's degree at the All India Institute of Medical Sciences in New Delhi. That is when I came across this species. So when I wanted to do my PhD work, I was really keen because the preliminary findings were actually very encouraging. But unfortunately, it is unfortunate, I'm sorry to say, these Ruellia species are not used by our Kenyan herbalists as a medicine. So when you go to collect, even they say, why are you taking our food for the goats? They are not used by our herbalists. I tried my best both in Isiolo, Kibwezi, and Machakos to get a trade name. They never had a trade name because according to them, these are just wild herbs in the wild. So I never actually I never came to get the local names because in Kenya, these species are not used by herbalists.
Okay, thank you very much. There's a question from Dr. Kinyoro, and he's asking, are there plans for single molecule analysis? And what would be the possible delivery methods of the molecules to the cells?
Plant single, I've not got any plant, what?
Single molecule analysis.
Yes.
Yeah, are you planning to undertake
I'm already undertaking. Yeah. I've already said that the ongoing work, I'm doing structure elucidation. When I get the actual compounds from NMR, these compounds, one thing is they will be subjected to in silico studies, where this is a computerized method of targeting compounds on the targets in the library. So I will look for targets for arthritis, for pain, for inflammation. When I get these structures, I have actually done in silico studies. It was just unfortunate that I did in silico studies from compounds from GCMS. So when I
Okay.
was trying to look for some funding, I was told, no, we want compounds from NMR. So I had very good results from the in silico studies, but I
Yeah.
was told they cannot take those compounds, only NMR. So the moment I do NMR, they will be subjected to in silico studies, where I'll be able to find the targets on which they work. Then when I find the target, then I can also do the in vitro studies for those targets, and then go to it's a very long to the animal experiments, but we'll have to do the targets first using in silico studies.
Okay, thank you very much for the response. Now, Agri wants to know, he applauds your good work, and he says that it is observed that when wild plants are domesticated, they tend to lose their natural active compounds that are usually intense as their survival mechanism in the wild habitats. So you talked about doing some domestication of the Ruellia in Kakamega.
Yes.
What about the potency? Do they lose their natural active compounds?
Actually, in my presentation, I also said that this domesticated Ruellia, because I've already standardized the protocol, because my interest actually is arthritis, rheumatoid arthritis.
Yes.
And I've already a protocol which is working. So for the domesticated plant, I have already done so much. I've done the roots, I've done the stems, I've done whole plant parts. All of them, I have subjected them to the in vitro and arthritic activity, and they have activity. The only thing that I saw, and which was to my advantage, is that the roots had less quantity compared to the aerial parts, which was to my advantage, because if the roots are not going to be as potent as the aerial parts, then when I've domesticated, I would not keep on uprooting the whole plant. So actually, to me, it worked in my favor, that the aerial parts were more potent than, had more activity than the leaves. So actually, the whole thing that the aerial parts that are active, I've used them in that in vitro test, and they are active. Different parts of the plants I've tested, yeah.
Okay. Thank you very much for that. I think at least when it comes to mass production of the plant, then that is very promising results. Now,
Yes.
Leonard wants to know, how did you handle the Nagoya Protocol when collecting your samples?
Okay, with the Nagoya Protocol, I think it would have come into use if these plants were being used by the herbalists. I think that is when I would have come together with the herbalists, told them, okay, this is doing this is what we can do. If something comes out of this, the sharing and all that. But then, as I've said, the plants are not used by anybody as a medicine. So it was not possible to now pick somebody and say, okay, we are picking these plants from this place and maybe something will come out of it. I've already said that these plants in Kenya to date, they are not being used as medicines.
Okay. You're being applauded here by Catherine. She says that you're doing a good job and looking forward to the rollout of the alternative intervention. Probably you could tell us, have you had an opportunity to test it on humans?
No.
For people who are the people who are having the rheumatoid arthritis?
Ideally, now to test on humans, you need that ethical clearance.
Yes.
That ethical clearance. So what I've done, I'm doing this thing step by step.
Okay.
After getting a patent, I got a trademark. I'm now applying from PPB to give me okay. Then with all that now, I think I can now ask to do clinical trials on patients. It's like you follow a particular procedure.
Okay. All right. Thank you very much. I think I would like to ask for the remaining minutes. If anyone else has a question, you could raise your hand. I will be able to see you using that icon, and then we can get Dr. Christine to answer your questions. For the remaining minutes, I want to put the floor open so that we can get your concerns, your questions.
I'm Rebecca.
Yes. Hello.
Yes, I think there's someone else who is asking what kind of compounds Dr. Wangia is expecting from her molecular analysis, what kind of compounds she would probably be expecting, or what is her expectation from the extract?
Okay, from preliminary phytochemical screening, there are flavonoids, there are phenolic, there are saponins, and I got sterols like stigmasterol, cytosterol, which have also been documented to have anti-inflammatory activity. So I'm really keen on flavonoids, and actually I'm keen on flavonoids and saponins, because this compound seems to have just a lot of saponins. I know saponins are difficult to get the pure compounds, but it's the task that is ahead. So for the time being, as I said, from NMR analysis, I got stigmasterol. But we are still, I have so many, like I'll end up with about 10 different compounds, and these 10 different compounds will be subjected to NMR, but they will be in the group of flavonoids, phenolics, saponins, because alkaloids are out. So whatever will come should be from that.
Okay, Dr. Wangia,
Yes.
you mentioned that in India, they use this Ruellia plant. I'm just
Yes.
curious, do they use it for the same, for the treatment of rheumatoid arthritis?
Yes.
Or
Yes.
what kind of studies have they done? And have they done it on human subjects? Is it in use? Do the herbalists there use it, or is it already recognized there as a form of alternative medicine?
Okay, what I can say, you know, when I went for my master's, you are at the best of your supervisor. My supervisor said, "Look, I have a plant here that I'm working on." There was one student that had just done the preliminary work, so I was the second student to work on that species, and it's the one who told me that it is used in arthritic condition, different types of arthritis condition, but the model that we used were both for inflammation and rheumatoid arthritis. So I tested both rheumatoid arthritis and inflammation, but it is like the herbalists use, whether the herbalists use, I can't say that maybe they did in humans. The herbalists use, that was a long time ago. So I was the second student of my supervisor to work on that, where I did much more on the chemistry and so forth.
Thank you very much. Peter Wanyama wants to make a contribution. Kindly unmute yourself. Peter Wanyama.
Okay, it was long.
Sorry. Kindly unmute yourself, Peter.
Yes. Okay.
Yeah.
Yeah, thank you, Dr. Wangia, for a good presentation. There are just a few questions I will inquire from you. Yes. When you did, you took your extract, because I know these compounds are known and they are standards. Were you able to try to quantify, because using GCMS, you can be able to quantify those compounds you're talking about, because they are known. Yes. So if you get a machine that is linked to a database somewhere, you insert in and run, get your chromatogram, then you're able to quantify. Did you do that?
No, I just used the chemical processes like saponins, the one with good extraction in the butanol. What I can say, I used just chemical processes. I did the phenolics, I did the flavonoids and saponins. I have quantities for those ones, but not the LCMS.
Okay. Then did you when you got your plant, did you vary seasons so that we say it's uniform, like across the board you get the same activity?
The activity was the same. What I can say that quantities was different times. I would collect around March and March. Let me just say anytime it rained. If it rained 3 months after raining, pick the plant. It was a guarantee, because they just sprouted, and if it delayed even got 4 months, the things would have dried again. So I can say the activity was similar. The only thing is the quantities. The quantities depended on the seasons.
Okay. Now the last maybe question. Let me not go further, because others need to ask. Now, when you got your extract, then you suspect these are the compounds. Then you look at the current medication of arthritis. Is there any correlation such that we can say your compounds your plant has this compound, and if you check these compounds, maybe the one you suspect, then relate with the current drugs available on the market, then we can say there's a correlation. Did you do something of the sort?
Actually, the compounds that are in plants, there's none in the market in that direction. The synthetics in the market have nothing to do with these compounds from these plants. These plants have been documented to have anti-inflammatory activity, but now I want to go further from inflammation to arthritis. But the current compounds are not. The non-steroidal anti-inflammatory drugs are acidic drugs. Then we have the biologics. The biologics, of course, are not like from plants. Then the methotrexate, then disease modifying. They're not. These compounds are not like the ones in the market. That's what I can say.
Okay.
Thank you very much.
Just the last question, please, before she goes away. Yeah, do you think your extract, maybe the activity you are seeing, okay, I did not see the MIC and everything. Do you think the activity is due to synergism of different compounds?
Actually, you are right. To me, if I'm going to have this product in the market, there are two ways. I'm going to have a herbal product because of synergy. When these compounds work together, there's a synergistic effect. That is why they end up being safer. But if I'm going to get a pure compound that is very active, it will now just be like a synthetic. The formulation of that will be easier because you can do tablets or capsules. But I would rather have the two products, both the herbal and the synthetic, if the synthetic will ever come, because the synthetic will be very active, but it will not have the synergistic properties of the other compounds in the plant.
Okay.
So I would have
thank you very
thank you. I will contact you. Okay.
Thank you very much. I'm seeing Sabina has raised her hand, but before Sabina gets at Sabina, I give you that chance. Someone is asking that why is arthritis too difficult to cure, and is it really cold induced? And is it true that women are more predisposed or more prone to arthritis than their counterparts, the men?
I didn't get the second question before the women. You said first one, why is it?
Why is arthritis too difficult to cure, and is it really cold induced?
Okay, I can say the problem with rheumatoid arthritis, and that is why I'm keen on this, is because it's an autoimmune disease. Nobody knows what happens, but for some reason, the body recognizes the proteins from joints to be foreign. So the body is fighting itself as if it is foreign. So it is not easy to do. It's just like the body would fight a virus, but this particular time it is fighting its own. So it becomes really difficult to treat it. So whatever the case, even me, what I can say, I'm not going to give a cure, but I'm going to give a safe alternative that when these patients are using, they're not having these side effects, and yet they are being controlled. And for the cure, we can't say now until we put the medicine to the patients and see how they are responding. But to me, it is an alternative that is safe, so that when the patients are taking, they don't have a lot of adverse effects. There are patients who stop taking, for example, methotrexate because of adverse effects, because the adverse effects become even worse than the disease. The condition is cold induced, because when it is very cold, they feel very bad. It has something to do with the coldness. That one I have agreed. And there is a genetic predisposition, because the women do have arthritis up to 3 times than men. So there's also some genetic predisposition. The fact that nobody knows how the autoimmune, how the body begins fighting itself, makes it very difficult to have a drug that is going to cure the body, because the thing, the body is not foreign, it is the protein in the body itself.
Okay, thank you very much for your response. Sabina, kindly unmute yourself and make your ask your question.
Okay, thank you. Thank you so much for that wonderful presentation. I have arthritis, but mine is not rheumatoid. So I was wondering, the plant that you got, maybe there are other species that could also relieve people of this other non-rheumatoid arthritis. The one like osteoarthritis and all that. And also I came in a little late. I don't know whether you had shown the plant, because somebody asked the name. Maybe if you show the picture of the plant, they could be in the same genera or whatever, in the same family, similar plants that could be used in your future research, as we pray for more funds. Otherwise, thank you so much. I'm Sabina Wangia from University of Nairobi.
Thank you very much, Sabina. Thank you.
Okay, what I can say, when you have a botanical name, and that is when you have one has a botanical name, you can actually get what the plant is like. In this, my last slide, that is how the plant looks like, how I collected it from the wild. So, but from the botanical name, one can see how the plant looks like. But in the future, I can put the actual plant. But for this particular condition, because these plants, they are effective in pain and swelling, it will still be used in osteoarthritis or any inflammatory arthritic conditions. But the reason why I'm really keen on rheumatoid arthritis, it is possible to gauge the parameters. For example, I said C-reactive proteins, erythrocyte sedimentation rate, and CCP, rheumatoid factor. Like these patients, when they are given, these parameters will be checked from the blood, and then you can be able to actually see, as these patients are improving, what is the effect on these other parameters. It will be easier clinically to monitor. But for pain and swelling, it can be used for people with osteoarthritis.
Okay, thank you very much, Dr. for that elaborate Q&A session. Over to you, Dr. Kinyuru, to conclude the session. Thank you very much.
Thank you very much, Rebecca. I think this was a very, very informative, very well articulated presentation. And I think we want to congratulate Dr. Wangia for doing that and achieving very good findings, which actually form a very good basis for a lot of future work. And I think, like people said, there is a lot that we need to learn and do about arthritis. I just remembered that some time back there were clinics in Thika and other places that were purporting to treat arthritis, and people were going, they were getting injections, several injections, and actually after some time people are getting well, pain relief, etc., etc. So, I mean, that's probably just food for thought, Dr. Wangia. But probably as you give your final remarks, you could say something about that in 20 seconds, Dr. Christine Wangia.
Okay, from my experiments and the way the extracts work, they cannot be formulated as they can't also be formulated as a tablet or capsule, because there is an FDA conversion factor which determines the animal dose, the human dose. The only way that extracts can be administered to humans are like sachets, like coffee sachets. Just put in water and drink, because the dose matter. The dose will be used as sachets, where you just take the contents, put in water, they dissolve, and you take. So the formulation will be a sachet for the formulation.
Great. Okay. Thank you very much. I think we want to stop there in the interest of time. Otherwise, we could really keep discussing and talking about this very interesting topic. But really, Dr. Wangia, I'm sure this is not the last time you want to talk about your research. Feel free to reach out to us if you have additional information or new information from yourself or collaborators who would like to share with us. We'll be very happy to give you the platform as the research directorate.
Thank you
and
very
with
much.
That, thank you. And with that, members, I think we want to stop there, and we wish you a good afternoon. Should you also be interested in giving your presentation on what you're doing, your research or potential research, kindly reach out to us at the Research Directorate at Research Production and Extension Division in RPJKUAT. So thank you very much. Have a great afternoon, and God bless you.
Bye. Asante.